Instead, we have the opportunity to make a habit of empathy, to recognize ourselves in each other.
Now comes the fun part, I think. I want you to let your imaginations go wild. I want the next topic is to come up with actions that we can take to change healthcare to be based on empathy. And think of all kinds of, as I said, let your imagination go wild.
What can we do, to make healthcare more empathetic? That's the question. It's the action portion of it, and like Obama said, to pay for some of the medical costs of becoming a doctor. He mentioned that when he speaks to the American Medical Association. So I think if that's kind of reduced, where doctors won't feel overwhelmed once they graduate, finish their internship, et cetera, and that then they'll go out for a few $100,000, maybe they can function better on an empathetic level as opposed to trying to pay off all this money they owe.
Hillary once said, it takes a village.
Right.
And, I think that's something I think that's really missing. I mean, wouldn't it be great if there were if each neighborhood really took care of their own
neighborhood.
Right, like your block, somebody gets sick, they don't have insurance, everyone chips in, or everyone, helps take care of this person.
They actually have something like that in Oakland. It's ran by a gentleman who's been doing this forever. It's Healthcare Initiative.
You can imagine if you're like your block in your neighborhood and you know everybody on your street and you have an agreement to take care of one another, within reason. Obviously, if someone's having a major medical issue, you might not have the expertise in your neighborhood, but you could provide a lot of things that, a visiting nurse would do, or rides. We are.
Yeah, we are.
And we kind of like let it run wild, the start things, just kind of
It's so much.
get out there,
Right.
and
But,
so we're getting a little wild.
yeah, well, she said we could be wild.
She did say that.
The charity these things called smile cards. You drop that into someone and it's a smile card and they have to hand that off.
Oh, see, I just wrote down call strangers and say, have a nice day. Now please call somebody else, and wish them a good day.
Letters are nice too. People don't get real handwritten letters and stamps anymore.
That's true. I was really astonished by how something as simple as someone saying, you're great, sort of set off all these neurons and made me feel better,
And so, in the last thing is well, how can we have a grassroots empathy movement, right? Well, for physicians, she can approach it from one respect, but for the rest of us, we can have empathy for our physicians. We can have empathy for the insurance agents that we're talking to on the phone that are getting cussed out all day long because people are frustrated and mad. We have empathy for the nurses that are overworked, and empathy for the front desk people because it's just kind of wild and they don't really know, and the paperwork that they have to do is monotonous and hard.
They would have someone to go to who is an advocate.
Yeah, Kaiser has somebody on staff that patients go to when they feel like people aren't treating them the way they need to be treated. So there's a person whose job is to listen and try to resolve complaints.
I don't think that's necessarily empathy, though. I think, that can be some cold, hard decisions about, if you went to a doctor and the doctor was very rude to you, or, he was very shaky as far as what he was prescribing, and you didn't think the doctor was professional, that would be kind of something you could complain about. And I don't know if the word empathy that way would really...
I used to be a facilitator for a group of women with cancer, and I would hear stories about people at Kaiser who, couldn't get doctors to return their phone calls, or they would have an appointment with a specialist and the specialist would not have the information that the primary care physician had. People who have to manage their healthcare across specialties have a terrible time because of issues of communication. So they're having somebody there that you can go to and say, these people are making my life hell. What can you do about it?
I'm not disagreeing that that's a good thing. I just
We're
see
trying
it as
to come
almost
up with
like,
ways to take action right now, so.
yeah, to bring empathy into the system.
So she's saying that we should have a patient, insurance companies could have a patient advocate.
As far as what we can do, I don't know. Is there that question is in any of like us four here? Is there any of us who really feels like it's a burning issue to the point of wanting to really make it a personal crusade and practice civil disobedience, stand out in the park and hand out leaflets for 2 or 3 hours, knock on every door, within a mile radius of your own neighborhood? I mean, is that something that is needed? Developing empathy as a group has to start with the group developing empathy within itself.
That's my focus, or it could be simultaneously. I have the expression empathy-based collaboration. That's really my focus. And
Collaborative, empathy-based collaborative, what was the last
Collaboration.
empathy-based collaboration
Empathy-based collaboration.
is a new way of activism.
So, does anybody have something written yet that they like to share?